Welcome, everybody. Thank you for attending. We're just going to let everyone file in here, and we'll be starting in just a moment. Thank you very much. And Dagny, I think we've gotten most of the attendees in, or at least a very strong number of them in, if you wanted to start.
Okay, good afternoon, everyone. Welcome again to the NACO Annual Conference virtually, and to our panel, Delivering Services in the Time of COVID, How the County World Has Changed. We have a really great panel planned for you today with some longtime county commissioners and county staff who have some important stories and information to share about some of the things that they have begun to do differently these past 9 months. Before I turn this over to our speakers, however, I want to recognize our sponsor for this panel. We want to thank USI Insurance Services for their support of NACO and our conference. And I'd like to introduce Brandon Lewis, Vice President, Commercial Property and Casualty for USI, and he'll say a few words. Brandon?
Thank you, Dagny, and good afternoon, everyone. I appreciate the opportunity to speak just briefly at the beginning of this session. One moment, I'll share my screen. Can you see that okay, Dagny? Okay, thank you so much. Again, thank you, Brandon Lewis with USI Insurance Services, and we're very proud to sponsor and support NACO's annual conference.
Brandon, if I may hop in.
Several government entities throughout the state of Nevada. We provide property and casualty, employee benefits, personal risk, retirement consulting, and specialty programs. And I work for USI because it gives me the ability to provide local service to our clients with access to national and regional resources. That's always been very valuable to me. And our Nevada team, again, very proud to serve public entities in Nevada. We've worked in depth with a number of different types of entities, from counties as well as municipalities, fire, transit, school, and water districts. We have the support of our national public entity practice that I've helped build over the years to get the best ideas from everywhere to help our government entity clients. And we work hard to provide the most cost-efficient program and serve the public interest. Since the beginning of the pandemic, USI has been a leader in responding to and providing resources to our clients and communities. Through our Steer Through Epidemic and Economic Recovery Task Force, we've provided a great deal of resources, webinars, and online materials that are available most to the general public. I would encourage you to take a look at our website, usi.com. There's a link on there that takes you right to the Public Health Emergencies page for resources that might be helpful to you. One of the specific tools we've developed is our zone risk assessment tool. And this tool we utilize internally, and we've also made it available to our clients and broader community. This helps you see the latest data to help protect employees in your communities. And this one's also available through usi.com. You can see the specific link here, usi.com/COVID zone tool. And here I just pulled up a sample of all the counties in Nevada. You can take a look at everything in one snapshot, and there's other resources beyond that that are available there. Very briefly, just appreciate your time. Thank you for the opportunity to speak and support NACO. I would encourage you, please contact me if you have any questions or if we can help you in any way.
Brendan, thank you so much. Thanks
you.
again for your sponsorship. Appreciate it. We could not put on this conference and do some of the other things that we do for our members without our sponsors. So thanks again so much. I also want to introduce Joe Ludnicki. He's an economist for the University of Nevada Extension Community and Economic Development Program. He is our technical guru today. He's helping us manage our meeting and our Zoom platform, and he has been such a huge help to us. And so we're really thankful to Extension and their partnership and support of counties. Joe, do you want to say a couple things, just technical housekeeping for the panel?
Absolutely. As Dagny said, I'll be assisting with the technical facilitation of today's session. As I am sure you have heard me say in any of the previous sessions, we have disabled the cameras, microphones, and chat for attendees. We do encourage all attendees to participate by asking questions through Zoom's Q&A function, which is at the very bottom of your Zoom window. This will allow us to gather questions to be answered at the appropriate time during the session. And as a reminder to our moderator and guest speakers, I may hop in from time to time if there are any technical hiccups or other items that need to be addressed. But thank you very much, and back to Director Stapleton.
Joe, thanks again so much, and thanks to Extension.
Your camera's off. Hopping in.
Thank you, Joe. I did that by accident. And thanks again to Extension. Thanks to you. So now I'd like to introduce our moderator for today's panel and turn it over to her. And that's NACO's President-elect, Clark County Commissioner Marilyn Kirkpatrick. Commissioner Kirkpatrick has been on the Clark County Commission since 2015 and has been chair since 2019. Prior to that, she served 11 years in the Nevada legislature, including as Speaker of the Nevada Assembly. Most importantly to us this year, Marilyn has been a tireless leader during the COVID-19 pandemic. She has ensured that Clark County residents have the testing and public health services they need. She's led efforts in her county to provide additional services to those affected by the pandemic. And she's done all of that while also helping counties statewide as we advocate for sufficient testing and funding, as well as clarity on the statewide directives that affect all Nevadans and Nevada businesses. So Commissioner, thank you again for all your service, and thank you for being here today. I'll turn it over to you.
Thank you, Dagny, and thank you to everybody else who's already spoke. I'm pretty excited about this panel because I think that during this time we have had to make many changes, and people have really, counties matter has really been the motto, because people now realize so much of what we do, while we've had to be flexible in order to navigate all of these services. You know, we still have to be able to see our children who need daycare for our essential workers. We still have to provide food services to many of our aging population and our most vulnerable. We need to be out there, as well as providing justice. You know, people still have to be able to utilize our courts and do all those. So I think that people will be excited to hear from our panel today, and we'll take some questions, but know that all the folks that are on the call today, they're one of many departments that are working across the state to ensure that people do have the services that are needed. So I will start with Alicia LaRude, who is the Assistant District Court Administrator from the 2nd Judicial Court in Washoe County. So Alicia has served as the Assistant Court Administrator since 2015. In this role, she's had executive leadership team, assistant management of court operations and personnel. Prior to joining the district court, Ms. LaRude was employed as a senior deputy attorney general by Nevada's Attorney General Office. While at the Attorney General's office, she has led opportunities to serve as the day-to-day counsel for large agency clients and serve as the litigation counsel on a variety of case types. Ms. LaRude calls upon this past experience in taking a risk management-based approach when considering decisions that affect the district court. Ms. LaRude received her Juris Doctorate from William S. Boyd Law School of Las Vegas, Nevada, and has a bachelor's degree in biology from the University of Nevada, Reno. 2021 has brought her the unique opportunity to call upon those long ago biology lessons while keeping our court operations moving during a pandemic. She is also a member of a Washoe County Board Association, a National Association of Court Management, the National Association of Presiding Court Officers, and is a past president of Northern Nevada Women's Lawyers Association. So you can see the caliber of folks that we have on this call for the panel and all of their resources that they bring. So Ms. LaRude, I'd like to start with you and thank you for joining us today.
Thank you, Commissioner Kirkpatrick, for that introduction. I so appreciate it, and I appreciate the opportunity to be here with you all today. I was asked to speak today about how district court operations have changed in the era of COVID. And like so many of you, boy, have they changed. Back in March, we were all hanging out at the court, gathered around our conference tables, talking about this new thing called coronavirus that may have an impact on us. We were still hanging out in our courtrooms. And then by mid-March, we had completely transitioned to a virtual environment. I'm sure that if all of us had a quarter for how many times over the last 9 months you have heard, you're on mute, unmute yourself, that all of our budgets would be looking a whole heck of a lot better than what they are right now. I really want to focus today on where the district court, where the Second Judicial District Court is today, but I also want to just talk a little bit about how our initial pandemic response worked, because I think that it really adds a lot of explanation for where we are now. We started testing our remote workforce capabilities back in February. Once it had become clear that this was going to be more of a pandemic situation, we started sending individuals home with various pieces of IT equipment. We hooked them into our virtual private network just to see what portions of their job they could complete at home with what we had available at that time, and then where we had holes that we needed to fill. That process proved invaluable when we all of a sudden shut down very quickly, because we already knew where our holes were. On March 6th, and I'm going to talk about this quite a bit more, we hosted a pandemic planning workshop at the district court. And that was made possible through the Washoe County Emergency Manager's Office. They actually provided us with a facilitator who went through and did a full half-day workshop. That included all of our justice system partners, lots of county agencies. So that way we all were kind of moving together and making our plans together. We closed to the public on March 17th, which was right about in line with when County Manager Brown also closed down county agencies. And then we held our first virtual criminal docket on March 19th. To this day, I am very proud that we had exactly 1 day of dark time. I talked a little bit about that March 6th workshop. As we have gone through this process more and more frequently, I have started to think of our justice system as really a spider web. And I encourage all of you to think of it similarly. When you think of all of the different agencies, county agencies, courts, municipal courts, justice courts, district courts, we are all interconnected in ways that are not always obvious. So if one of those strings pulls, if there's a little bit of tension on one of those strings, it really impacts all of us. That has become very, very evident as we have worked through this process. While it is so important for the judiciary to always have the ability to act independently, it was equally important for us to coordinate with all of the county agencies who access the court services most often so that we could all move together. We moved from an operational model where everybody is gathered together in person in a courtroom over to this virtual courtroom. It wasn't a field of dreams scenario where if we build it, they will come. That wasn't going to happen. We needed everybody to build and plan and troubleshoot all at the same time so that it would be a success. There are some specific challenges through this situation that I think are somewhat unique to courts. The first one is that we have a lot of our mission critical functions that have to be completed on a statutory or a constitutional timeline. We don't have a lot of wiggle room within some of those timelines. Case types that come to mind would be criminal cases, child welfare cases, guardianship cases. All of those are driven very heavily by statute and by constitutional mandates. The other thing that plays into some of those timelines is that we have different federal requirements that require us to do and hear cases on certain timelines. And those, of course, are tied to funding. This isn't a good time for us to be missing those timelines and then potentially jeopardizing that federal funding when funding is short for all of us. Constitutional due process is something that is unique to the courts, and that due process in our case in particular requires that we have public access to our hearings, and more importantly, that people have an opportunity to participate in their hearings. So when we talk about which portions of our business we can really throw into a virtual model, we still have to make sure that that public access is available and that individuals have the ability to participate in a meaningful manner in their hearings. And then there is the power of the subpoena. Again, I think that, well, this one is certainly unique to courts. And I want to talk a little bit about just what that means to us. So we subpoena in the court system people for all different kinds of reasons. You have to show up to court because you're litigating a case. You've put this case in front of the court, so we're telling you that you need to be there. Witnesses are subpoenaed. We subpoena juries. So we have resumed jury trials. We have now rolled those back. But about a month ago or so, we called in a jury, and within that panel, there was a gentleman. And this gentleman was just in rough shape. He could barely walk, and that was with the use of 2 canes. He was on oxygen. He had a number of other physical health issues that were unrelated to COVID. My understanding is that those issues were related to an injury that he sustained in a public service employment position. And as I looked at that individual and as I interacted with him, all I could think was, here you have a man who is in horrible physical condition. He has come down to a court to fulfill his jury service, even though chances are that his body would not have allowed him to actually sit through a trial. But that is the power of a subpoena. It was very humbling, I think, for those of us who did deal with him in that moment and interact with him, just to know that he came, everything going against him, he was still there. So we at the court, we are very, very cognizant of the power of the subpoena, and we don't want to be calling people through our doors unless we can assure that our doors are as safe as they possibly can be. So this goes through a little bit of our philosophy as we have worked through all of this. We know that we have an obligation, and we take our obligation very seriously, to provide access to justice. That goes for both our criminal cases and our civil cases, and then family, that's its own unique case type. So we know that we need to provide this access. We know that we need to provide these services. It is our obligation. So we want to provide the opportunity for individuals to litigate their cases to the greatest degree possible while we are still meeting safety standards. The National Council of Juvenile and Family Court Judges, NCJFCJ, it's a mouthful, in May of this year, they released a statement that really does a great job at summarizing the tension that exists between a court's obligation to provide services to the citizenry that it serves, but also to provide those services in a safe manner. And then we want to continue to abide by CDC, local health, whatever guidance is out there as far as safe operations. Not only do we want to do that because we're in the middle of a pandemic and public safety and health is of course of utmost importance, but also because the state legislature passed Senate Bill 4 earlier this year during a special session. And that really provides liability protections for government entities if those protocols are being followed. So we certainly, just from a pure liability standpoint, want to do our best to follow whatever guidance is out there. I apologize, I'm trying to get this slide to change. Where we are now. So we at the district court, we have 21 departments that are running court dockets every single day via Zoom. And since March, our Zoom accounts have had approximately in excess of 6,500 Zoom events. That would not have been possible if it wasn't for cooperation, coordination, support from so many different agencies. The Washoe County Sheriff's Office has been essential in making sure that we can access our in-custody defendants via Zoom. Our county manager's office has provided endless support. Health and Human Services, they have made their social workers available for child removal cases via Zoom. So that one really, really took a village. But what it is enabling us to do is to continue to fulfill our mission critical functions while keeping people safe. Because instead of everybody gathering together in a courtroom, they're all sitting at home attending court. We did resume jury trials. That since has been rolled back and put on hold. We did that last week after the governor spoke. So right now we will not be resuming jury trials again until December 14th. We will see if we're able to proceed on that date. And then the other thing that we've been doing is retrofitting space. So we have started, I'm going to talk more about it. We've started retrofitting some space to meet today's needs in a pandemic, but we're trying to do that with an eye toward the future. So how can we retrofit it to make things better when we do go back to so-called normal? This is what our virtual hearing looks like. So we have everyone, as you can see, attending from home. The judge, courtroom clerk, so our court staff, they are all at home. Court reporter, the attorneys, the litigants, an interpreter. We have an absolutely fantastic interpreter who really has figured out how to use Zoom to make sure that all that language access is there. And then we also post our links publicly so that if you are a member of the public and you want to see what's going on in a court hearing, you can go to our website, you can click on that Zoom link, and it's going to let you watch the court hearing just like you're watching today's webinar. This bottom picture, that is what our court hearings look like from the detention center side. I do want to say that this photo was taken pretty early in the pandemic process. So our detention center has since updated their policies and their protocols. Everyone is now masked. Everyone is following social distancing. Jury trials. Jury trials are unique. They are difficult. While I think that we have done a pretty darn good job at figuring out how to do much of our business via Zoom, a jury trial, especially a criminal jury trial, is not going to be held via Zoom for a number of reasons. courts around the country have been struggling with how to hold jury trials. The plexiglass that you see here, this is one of our courtrooms. That has been a solution that has been utilized across the country. Jury selection, for anybody who hasn't really seen a jury trial in progress, jury selection can be up to 100 jurors that we have there while attorneys go through and try to select the 12 who will serve on a jury. We clearly cannot put 100 people right now in a room. So what we have been doing is we have been socially distancing those jurors across multiple areas of the court, and then using two-way audiovisual connections back into the trial courtroom to get through selection. It's not ideal. It takes a ton of staff resources. It takes a ton of tech resources, but it is allowing us to hold jury trials. We held 3 between September and October. And like I said, right now, I don't know. We're hoping that we can get back going December 14th. I don't know how realistic that is. We have been sending supplemental jury questionnaires out to our panels, asking them about COVID exposure. We ask those jurors to call in if they have COVID symptoms, if they know that they've been exposed. We're trying to not even get them to show up at the court. We go through pretty extensive health screening before they come through our front doors. Then they get to go through our normal weapons screening. And then we finally get them into a situation where we can start selection. It is a process. It's not ideal, but again, it's allowing us to give those individuals, those criminal defendants, their constitutional right to a jury trial. This one I am really excited about. So if you can see that background photograph, this is our filing office, or what used to be our filing office. I'm excited to talk about this because I really think it highlights some of the good to have come out of this entire situation. When CARES funding was released to the state and local governments, none of it was earmarked specifically for court systems. That's in contrast to what occurred on the federal side, where some was earmarked specifically for the federal court system. But the Washoe County Manager's Office, they saw what we were doing, or what we have been doing with jury trials, and they suggested leveraging some of the Washoe County CARES money to retrofit what was our filing office space into a large courtroom that's going to allow for social distancing both during jury selection and during the trial. So since March, the vast majority of our filing office staff has been working off-site. I should say that 90 to 95% of our staff are still working off-site. And they are working. We have them connected back into our network. So we're pretty proud that we've been able to keep our business going while keeping those employees as safe as possible. But even when we had all of our staff on site, our filing office space was just too big for what we are using it for. The filing office was built during a time when people would walk in with their papers in hand and stand in line so that they could conduct their business with the court. We don't have that anymore. Almost all of our filings come in electronically. So we had this big empty space with employees working around the perimeter. We just didn't have the lines anymore. So what the CARES funding and the county manager's office is allowing us to do is flip this space into a giant courthouse multi-purpose room. I'm starting to think of it as kind of like the elementary school cafeteria / auditorium / the recess place when the weather is bad. We are putting in here modular furniture that we can move, so it can be set up as a courtroom. It can be set up long-term as a jury assembly room. It can be used for a trial. It can just be used for selection. It can be used for our all-staff meetings when we finally all get to come back together. But this is a much, much better use of this space long-term, although it is meeting our short-term needs. And then we can flip our filing office that doesn't require the space that they had into our jury assembly room, which was a much, much smaller space. Again, not possible without the support of our county. then just to close, I apologize, I'm having trouble advancing these slides. I don't think that any of us really would like to keep 2020 going, or that we would all like to go back through this process. However, I think that for all of the bad that has come out of this, there really are a lot of silver linings that we really all should be grateful for. Challenges for us that we just haven't figured out how to address. A significant portion of our population, more significant than what I previously appreciated, they do not have access to technology. Even if they do have a smartphone or an old iPad, they may not have Wi-Fi at home. When we shut down, we were shocked to find out that a number of our employees didn't have Wi-Fi. And then when places like Starbucks shut down, that further limited technology access for public. So that's something that we continue to work through. I know that we at the court, the Washoe County Library, we've extended our Wi-Fi perimeters out to our parking lots. So that at least now people, if they do have a device, they can try to access that Wi-Fi. The continued disease transmission, we feel like we're taking 2 steps back in the direction of reopening to the public, and then we take 2 steps right backwards again. So that, of course, is a continued challenge. One other thing that we struggle with a little bit is how do we take care of our employees in this environment? Courts are not fun places typically to hang out in. Our employees sit through court hearings and they hear a lot of the bad that the world has to offer. It's a lot easier on those employees if they can even just briefly interact in a hallway and say, man, that was a really tough hearing. And somebody understands. Right now, they don't have that opportunity. So keeping our employees connected and making sure that we're attending to their mental health, I think, is a continued challenge. Now, the benefits, the silver linings that honestly, I personally am grateful for. I won't speak for everybody at our court. I am convinced that we have made at least a decade worth of technological advances in the last 9 months. If you had looked at our judges 9 months ago and said, you are going to be conducting court via Zoom, every last one of them would have laughed at us. Zoom comes with some benefits that I think will keep long-term. We have found that in cases like our protection order cases, our domestic violence cases, or our family mediations, domestic violence cases, people are more willing to come to court because they don't have to have that physical interaction with the individual who they have said has perpetrated violence against them. Mediation and settlement conferences, people are more willing to come to a settlement, again, because the tension that comes with physical interaction, it's not there. I think that our family bar has expressed that they hope that we keep virtual hearings in those 2 areas because it really is just so much more successful. Virtual hearings reduce litigation costs, especially in a county down like Clark County, where it can take a long time for an attorney to travel to court. And if that attorney is charging his or her client for that time travel, that can really add to litigation costs. There are movements around the country to actually make virtual hearings in certain case types the assumption, and then do physical in-person hearings only if necessary. I'll be very interested to see how that works long-term. Remote workforce acceptance. Government has never been an area where we really have considered the advantages to a remote workforce. But again, long-term, it helps on facility costs. Washoe County, like so many other places in Nevada, we're growing really fast. We're outgrowing our facilities. If we can economize and if we can do some of those functions off-site, it may help us long-term. And then increased collaboration. In Washoe County, I believe that we as the district court, we have had a good relationship with our county commission. We've had a good relationship with our county manager's office. Even with that, I think that our relationship continues to improve through this process, as well as with our stakeholder agencies, because we've had to talk. Before we didn't have to talk. Everybody knew how to get to court. Everybody knew how to go to a hearing. now we've actually had to collaborate and we've had to talk about these things. And for that, I'm very grateful, because I think that it has given us all a window into one another's worlds that we may not have otherwise had. And that concludes my portion. This is my contact information. If anyone has any questions, of course, use the Q&A, I'm sorry. But otherwise, please feel free to reach out to me via email. Thank you.
Thank you, Ms. LaRue. That was a lot of amazing information that will be helpful going forward. What I'd like to ask of the participants, if you would put any questions that you have in the question and answer period. We'll go ahead and go through all of our panelists, and then we'll come back and we'll address all of those questions. So we'll give our panelists about 20 minutes each, and then we'll come back and go through. So if you have any questions, don't hesitate to ask anything. We'll answer those in just a little bit. So with that, I'd now like to introduce Lyon County Manager Jeff Page. Jeff, you and I have been friends a long time, but I'll read the script because you're due a lot of accolades for everything that you do. Jeff has an extensive history with Lyon County and local government. He's a third-generation Nevadan and a lifelong resident of Yerington and Lyon County, Nevada. Jeff was appointed as Lyon County Manager in 2010. Prior to that, he was the Emergency Manager Coordinator. He has worked most of his career in public safety. He served as a volunteer with the Yerington Mason Valley Fire Protection District and has held ranks of firefighter, EMT 1, engine operator, captain, and assistant chief. So Jeff has worked for the Lyon County Sheriff's Office, starting as a reserve deputy manager in 1985 and leaving as a captain in 2006. During his tenure in the Sheriff's Office, he attended Northwestern University School of Police Staff and Command, obtained his executive post certification, and held the ranks of deputy chief, deputy sheriff, corporal, sergeant, lieutenant, and captain. He's administered and managed the jail, 911, dispatch, internal affairs, search and rescue, and emergency management. So, Jeff, I'm sure you can add a lot to this conversation, both being a county manager and your expertise with the jail system and what we're seeing there. So why don't you go ahead and give us your view on this?
Good afternoon. Thank you, Marilyn. So I've been asked to discuss basically the community connection in dealing with COVID from the perspective of local government. So let me start off first by reiterating something that was just discussed with the court issue, and that is the men and women that work for our respective counties and communities. So from the protection perspective, you know, we all think about making sure they have masks, making sure their offices are clean, that they're maintaining social distancing. I'm not going to talk about that. That has been beat into us pretty hard. What I'm talking about is protecting our employees from the people that we serve. Because if you haven't noticed, I don't know about your location, but people are really angry right now. Whether it be COVID or elections, the neighbor's dog barking. I've been quarantined at home for 3 months and I don't like my neighbor and now I have to deal with it, whatever the situation may be. And so we have worked with, through human resources and others, with our department heads and our elected officials to make sure that we stay on top of our employees. And when we see that they're struggling, to get involved, find out what's happening and have discussions with them. And the best way I have found to make sure their employees are taken care of is through good, solid information. Now, I am, unlike Clark or Washoe County, I live in a county in which the only news you ever see on television about Lyon County is bad. The only time you see us in the newspaper is something major has happened in our county. We have a local paper of sorts, but we have no local reporter. They're all from Reno, and they don't pay a lot of focus or attention to what's going on in the county. So when that happens, social media becomes the new norm. And I don't know if you've noticed this or not, but not everything on Facebook is true. And so we start dealing with those issues from March of 2020. For those of you old enough to remember what an e-ticket is, from March of 2020 to now, this has been an e-ticket ride in Disneyland. It has been, we have faced more opportunities to improve and to strengthen in the last 9 months than in my 36 years of being in Lyon County. It's been phenomenal. But the challenge that I think we all face in local government today is making sure that the information that we're putting out is correct and getting out in front of it before it hits social media and people are starting to believe whatever their neighbor has said. That same neighbor they don't like is now telling the gospel's truth, and local government's not telling the full truth. And getting out in front of those issues, it can be difficult in rural Nevada. Again, in Clark and Washoe, where you have electronic media, where they have 24/7 people putting things out on a regular basis, it may not be as complex as it is in rural Nevada, where you don't have that luxury. So we have come up with systems in place, utilizing our website and getting things out to social media, that as soon as we think something is going to happen, we start working on getting that information out to the public and getting them to work together. Unlike the urban north and the urban south, we don't have capacity or skill set to do many of the health things that health districts do. So we've entered into a cooperative agreement with Douglas, Carson, Lyon, and Story, and created the Quad County Health folks. That process, we opened up a joint information center with all 4 counties providing information to the JIC. We opened up a Quad County Emergency Operations Center where we supplied our staff. And now we're taking staff out of the comfort of their office and their normal operations and putting in with a group of people that they've never met before in a very stressful time. And it worked phenomenally. And we've been focusing on working together as the 4 counties to get the information out to the public on what the true numbers are. The public started to ask early on, we don't care that there's 250 cases in the Quad County, where are those 250 cases? So we worked with the various IT departments and we started putting out information by zip code. We've had a few people that want to know if their neighbors got it or not, but we told them zip code's as close as we're going to get. But we were able to start working with cooperatively the 4 counties to get that information out. And then everybody was focused on COVID in March, April, and May. And all of a sudden we had this pesky little thing called an election come up. And you got people running, it's difficult enough on national level, but now you have people running for a local office, county commissioner, city council, whatever the position may be. And there is no platform in rural Nevada for them to go to because everything's shut down because of COVID. There were a few Facebook or social media Zoom type meetings for candidates, but for the most part, the general public in my county was voting for somebody that they had never met before. That they were going off of what was put out in social media to get those people elected. And those politicians that were running for office didn't know who their constituency was because they couldn't go out and knock on doors and shake hands and kiss babies. So that became a bit of a challenge when people started putting information out. We have a policy on our social media platforms that we do not address political issues. We don't endorse or oppose or question politicians. But there were times during that process where one politician would say something that was misinformation or untrue about what the county was doing or wasn't doing. It wasn't conjecture, or it wasn't fact, it was conjecture on that person's part, where we had to put out the correct information without answering their question. I used to work in the sheriff's office, and when I did, I had a judge that worked there by the name of Bill Rogers, and he always said, never answer a letter to the editor. Today, social media is that letter to the editor. So we had to find creative ways of getting the correct information out so the people would be able to make a rational choice as to who they wanted in those elected positions. The election went off well in the primary. It was all mail-in. We had no real significant issues. And then comes the changes with AB4 and same-day registration in a small rural county. Small, we're 57,000 people. We're not Esmeralda small, but 57,000 people, and trying to manage that with the same staff that we've always had to do elections. And now you have poll workers who, I don't know about the rest of the counties, but most of our poll workers, I think it's a requirement. You have to be 70 years of age or older before you can be a poll worker. So we have all the older Americans of Nevada working in these polls who are the most susceptible to COVID. So we came up with some creative ways to deal with that, with plexiglass partitions, making sure they had masks, all those things. And then we had the poll watchers coming in from out of state, you know, and some of them came from that great nation of California, and that tends to irritate local people, right? Or we had some people show up from New Jersey, of like, how did you get here? So we went through that process, and all those things, as they tie into COVID, is what I'm trying to tell you is that it wasn't all bad. We have learned some valuable lessons because of COVID. I live and work in a county that has 8 distinct communities over 2,100, almost 2,200 square miles. Our Board of County Commissioners meeting is kind of like the state of Nevada. The state capital is in Carson City, but the majority of the population's in Southern Nevada. Well, in Lyon County, the county seats in Southern County, and the majority of the population's in Northern County. And people up north voice their concerns that they don't have the time to drive all the way to Yankton for a commission meeting. We had planned on July 1 of doing something similar to Zoom or some other platform to get people to be involved with their local government. We just started a little bit earlier in April with utilizing Zoom. And we saw great participation early on. And today, I will tell you that those same people that actually came to the board meetings are the same people who are now Zooming in, and very seldom do we see a large crowd. But with that technology, as right now what's going on, everything I say is being recorded for NACO. So if I say anything wrong, I can't deny it because Dagny can pull it up and show everybody, right? Well, we're now able to record those meetings, save those meetings, put them on our website, put them on our social media platforms so people can watch their commission meeting or planning commission meetings from the comfort of their home when they want to. We are working with technology to set it up so that you can click on an agenda item and go right to that section of the board meeting and address that process that occurred for that board meeting. All the things that we did with technology wise were great, but what we need to focus on now, all of us, if we're using technology for anything, is what happens when your technology fails. Are you prepared? Because what I'm seeing, what I'm hearing in other disciplines is that is a concern now. America has gone to Zoom or other platforms to do these meetings. What happens when that system's hacked? So we need to work together at the state legislature, as an example, and ensure that there's legislation in place that helps counties and cities address those issues and helps the state of Nevada address those issues. We need to reach out to our congressional delegation and see if we can secure federal funding as well as federal legislation to help us with those issues so we can protect those things. Because what I'm going to tell you right now is the public at large is probably not going to want to change some of the things that have happened since COVID, like being able to attend a county commission meeting by Zoom, being able to participate in meetings that aren't necessarily open public meetings required of open meeting law, but now they don't have to drive from Reno to Yankton for a roundtable discussion on their development application. They can do it from the comfort of their office. I no longer have to pay contractors like our engineering that we contract out to drive all the way down to Yankton or to Dayton for a meeting. So we need to find ways of protecting those things so that they can't be hacked into and they can't be taken away from us or utilized for illegal activities. The other great thing about COVID that has occurred, I believe, at least in our community, in our region, is, and I realize in the urban areas it's a little more challenging because you have so many more people, but we now have neighbors who have lived next door to each other for 8 years, have actually met each other now, and they're talking to each other, and they're wanting to get involved. They're calling and saying, hey, what about this? What about that? For the past, we didn't have that. We got busy with our own lives. we got tied up with whatever was going on. Well, when you can't go anywhere, when you can't do anything, that becomes, you got to find something to occupy your time with. And so we're starting to see some more community building, especially up north, where you take Fernley, that when I was in high school was single B and we were a AA school. They're now a 3A school. In 20 years time, they became 20,000 people. And now those folks are starting to become neighbors. The courts had discussed the relationship building that has occurred from the courts to the county manager's office. I can tell you that from my perspective, we have a tighter relationship with not only the courts, but our two cities, our special districts, folks that we used to deal with in passing from time to time is now a daily interaction. And I think one of the biggest things that people miss through all this is I look at NACO's involvement with a lot of this stuff. Marilyn was there, JJ Goguchia was there, Dagny was there dealing with the LEAP and dealing with the governors. And I realize some of that has slid away. But the governor recognizes that NACO and the League of Cities are important parts of the government process. Where before, I think past governors knew they were there, but they never saw the active role that they had with their constituents. And I'm hearing that back from the various bureaucrats at the state levels. You know, hey, would you mind checking with NACO and see what they think about this? Or would you reach out to this group and see what they think about that? That never used to happen before. Okay? Local government, from my perspective, just had a huge, again, a COVID plus, a huge shift in the right direction. The governor just appointed the gentleman by the name of Dave Fogerson to take over as the director of emergency management for the state of Nevada. And I'm not here to bag on any of the past directors. He's the first guy to come from the local side of things up to that position and understands not only the urban issues, because he's worked with urban and the fire side, but also understands the rural issues and has a direct connection to the folks at the governor's office. So when we have issues and problems, we have somebody to work with. So there's been a lot of positives, because that's what we focus on. At least my pessimistic personality, I tend to work on just the negative side of things. I'm looking at what are the positives of COVID. It's been a change in technology. It's being able to get out to our constituents. I'm a in-person kind of guy. I like to shake your hand and give you a hug. I can't do that right now, so at least I can see you on a screen and have a conversation with you. It's seeing the public and working with them to, yeah, I get that you may not think that what the governor wants to do is the right thing, or you think he's not doing enough. But let's focus on just taking care of your neighborhood and our community as a whole. And starting to see that process change. As I watch social media, as I watch the comments, we're seeing less and less of the "this isn't real" yada yada to, okay, I don't like it, but I understand it. And the more we can focus as leaders of our local governments, whether you're a county commissioner, a county manager, a department head, elected official, if we can all work together to show our public that we're doing everything humanly possible to reduce the risks of COVID, to make life as normal as possible, it goes a lot longer, a lot better if we do it in a positive way than if we try to buck the system. We are supposed to be the leaders that either they elected into office, and those elected officials put people like me into positions that we're in as leadership, so that we can help them keep faith in local government. They may not trust Washington, and they may not always like Carson City, but when they lose faith in local government, I'm here to tell you, people, we're done. And so we have got to work together to continue through this process. We don't know what's going to happen Tuesday with the governor's decision, how he's going to handle things. But I think if we continue to work together and recognize the positives, work with our public, show them that we aren't the big bad guys. We're not there to shut everything down and make their lives miserable. Find ways to educate and inform. We've taken 0 enforcement actions since March. We've sent a few letters that said, if you don't comply, bad things can happen. And then we sat down and talked with them about it and worked through the process. And I think if we continue that thought process, if we continue working with our public, that will get through this with minimal resistance. There's always going to be the naysayers. There's always going to be the haters, but they're a very small segment of the population. So with that, I don't really have anything else. I'm very pleased that NACO chose this as a topic, and I'm very thankful and honored that Dagny asked me to speak about this. So I'll take any questions by the chat later on, and if you have questions later on, if you just go to our website, you can click right to my email and email me your questions.
Thanks, Jeff. I thought you brought out also a lot of good points. And one thing I really kind of want folks to know on this call, you know, our government employees have stepped up, put their own families aside during these times and been there 100% to really help us deliver service, because we are essential and we still have to deliver those services. So kudos to every single employee. I don't think that they've even had a day off, and I thank you for recognizing that and bringing it up. But we really need to do a better job of letting our employees know how much that we appreciate them. I mean, look, for me, my own husband said this morning that take a chill pill. It's going to be okay. And I'm telling him distance learning is going to be the death of me. But sometimes I have to step back myself. So I appreciate that. And there's a lot of silver linings, and I think that this is a good roadmap for us going forward. So with that, I'm going to introduce the person who has to spend the most time with me, second to Dagny. My husband is third on the list. Kevin is first. Kevin Schiller is the Clark County Assistant Manager. He is responsible for family services, social services, public defender, Clark County Shooting Complex. He's also the county manager's representative to the county clerk's office. Mr. Schiller was appointed by the Clark County Commission on May 16, 2017. He served as the assistant county manager for Reno Washoe from the January 2014 through 2017. Prior to that, he was the director of Washoe County's Department of Social Services, which he was there for more than 17 years, leading integration of human services and creating innovative programming to serve our most vulnerable children, adults, and families. He began his career as a social worker and a juvenile probation officer for the state of Wyoming. And it is helpful to have someone that knows both ends of the state, especially for like Dagny and myself, when we try to balance everybody's needs and what we need. So Kevin, I know you have a lot of information to share, because it's been a work in progress, very fluid. So why don't you go ahead?
So good afternoon, everybody. Yeah, I spend about every day with Commissioner Kirkpatrick, and I would say by way of this Zoom, I guess I would say with that, especially if I look at the past 9 months, it's been much more than that. And I just want to make sure she can jump in anywhere here, because she's pretty much lived everything I'm going to talk about. But at the local government level, I think I was listening to Jeff talk, and who I've worked with for a long time too, that the crisis it's a crisis, and I'm going to talk about the future and what that holds in terms of needs. But I think the other piece in COVID is it's also created some opportunities for us to change how we look at how we deliver services, how we practice. So to Jeff's point, I think it's moved the needle where I don't think we would have moved the needle previously, which I think will have benefits very long term, well beyond just the COVID crisis. And with that, I think that's one of the focuses that we've tried to really kind of continue to move forward. I'm going to bring up the brief PowerPoint real quick. Can everybody see that? I'm assuming. Dagny, can you see that? Okay. So I just wanted to kind of go over and use these kind of as a guide. Hang on, I can't get trying to get my screen to move here, but it's not moving. There we go. Hang on. Okay. So with that, I kind of want to talk about, if you go back to March 17th, and I'm going to focus this on human services. This is the short list, but to give you guys a sense in the crisis, and I'm preaching to the choir, obviously we have a COVID crisis that started in March and it continues today, and it's going to continue well beyond today. So what does that mean? So, you have basic needs for families. And when we say families in a social service world, we had a typical world we were serving in our social service areas. And then what happened when COVID hit is it hit everybody. So that crisis has created mass needs. So I highlighted one of the top ones, which is rental assistance. It's projected conservatively that down here we're going to have about 140,000 households conservatively that will be in need of rental assistance, food assistance ongoing, case management, and navigation. When I say basic needs, bottom line is just how do we have a place for people to live and for them to have food with loss of employment and inability to do that. As I think most people on this call probably know, the CARES funding came through, which has been a huge allocation, which supports many of these things, which I'll talk about in a sec, and how we manage that. Housing, obviously, I just talked about shelter related to people just in their household. But the other piece that Commissioner Kirkpatrick and I lived literally, I think for about 2 weeks straight, was an immediate reduction in our shelter capacity for our homeless population. So what happened was we had positivity that was happening within the shelters, which immediately created a reduction in that support. And in some instances, we actually had shelters just shut down completely where they really wouldn't have had to. So we ended up kind of in a two-edged crisis. We had to set up a safe place for them to sleep. And then at the same time, which I'll talk about in a sec, we had to set up essentially a deferred or kind of a diversion hospital setting for medical assessment to move people. So that was a significant component. And then that transitional supportive and affordable housing, the key there is with people being positive and with the continued reduction in capacity, we can't house them in shelters like we used to. Plus, the outcomes are better when you put them in transitional housing. So we've utilized CARES dollars to support kind of a housing continuum from start to finish. But then I also want to make sure I highlight, it's not just about, in the context of what I'm explaining, it's not only about homelessness, it's also about those people that were going to work every day and now don't have a job. So that nexus is really critical. Workforce training, childcare, and educational supports, those are all key critical social areas where we're seeing ongoing impacts, where we've implemented programming to support structure to make sure that we can maintain or at least do the best we can to keep kids somewhat engaged in their school system with supports, but also the workforce training in terms of how do we move people from one end to the other so that they can be sustainable. This is kind of a list, and I'm going to show you two versions of this. This is the COVID response programming. If you went back to about April, where we were. So this stair step that goes from prevention and diversion all the way up to the home ownership, all of this is critical. And we use this pre-COVID as we plan as a regional county. As you guys know, we do regional services. So all of this programming at a county level in this stair step was happening. But with COVID, we had to essentially change that. So we had to, obviously, if you go to a couple of these bullets, and I'm just putting my arrow here, expanding non-congregate care, that's where we had to essentially take people that would have been in a shelter, we had to put them into different motels and places with programming because they had to be individual in their own self-contained units. We had to expand workforce programming, rental assistance, all of those things, medical fragile diversion programming to assisted living. We found that our homeless population was actually much more fragile than even we thought with all the existing programs that we had. We had to set up multiple testing sites. This will tie into vaccination and COVID resourcing later, but Commissioner Kirkpatrick led kind of the charge related to one of the highest positivity rates for us was in the Hispanic population. So we did mass advertising and campaigning, which continues today to support that. And then when you go through this stair step all the way through these processes, we have essentially expanded capacity from prevention all the way up into rental assistance through COVID. And one of the key issues, I think our award, Commissioner, was about, what, 295 million, something like that, in our CARES funding. And there was allocations that also went out to some of the local jurisdictions, but as the regional provider, the single largest lift for those costs and where we are expending those dollars is toward our social service need in terms of those community needs. And to give you an idea, we just had a meeting yesterday, which I'll talk about in a sec, but we have allocated up to $88 million just for rental assistance to support that number that I showed you of those households of about 120 to 140,000 households. What does that mean in terms of how much need can we make? It'll probably make a dent to about 30,000 households to 35,000 households in the end with all of those funds. So typically that's the key piece there is there's obviously much more demand than there is resource. But the other piece, and I'm going to talk, so when you look at this stair step, this was more what we had to develop in crisis. But then what we also had to do in that crisis is we lost our shelter. And so what we had to do is we worked with the city of Las Vegas from a funding and programming perspective and set up our ISQ. That ISQ is really just a diversion for the hospital. So where you had people coming out of a shelter who were testing positive, we had to place them. We had mass tents that were over at our Cashman Center and basically set up operations, maintenance, security, and capital expenses all. And I just gave the numbers here so you had a sense of what it looked like in terms of the costing. So when you look at that budget of about 8.4 million, we stood that up very quickly. And this is not hospital surge. This was strictly diversion and navigation for those that were positive and or symptomatic so we could continue our structured process. What we did with this though, which I'll talk about next, is this really became the front door for us to move people into our transitional housing that we developed because we lost our shelter. So as you might think, and Jeff, you were talking about this, crisis is opportunity. So what was happening in Clark County? Tourism was non-existent. So with tourism being non-existent, I had motels that are not in your strip corridor, but scattered throughout that had literally nobody there. So what we did is we were able to go out and essentially do master leases with those motels for long-term master leases. And then at the same time, bring in medical, case management, and intensive programming for those that are placed. And when I say this, I'm talking to it from a vulnerable population, but we also have a tourist hotel. We have places where people were flying in and could not go home. We have first responders, medical personnel. We leased and continue to have these master leases across the valley to support placing that population when we have COVID positivity and to reduce spread. So that has not ended. It continues to this day. And then I'll talk in a second about the fact that we are not going to turn off that spigot on December 30th just because the CARES funds have to be expended. So the mass crisis, and I'm talking fairly quickly because there's a lot to talk about, but on the same time, if you think about diversion from the front to the back and placement, what we had to develop essentially was a system of care within COVID to support the COVID impacts tied from a first responder and our employees all the way down to our homelessness population. And in doing so, then we also had to target, okay, how do we deliver the medical care? How do we get the services in place? How do we transport a COVID positive client who shows up when tourism opened back up over at Caesars? How do we move them from Caesars to our tourist COVID hotel? We had to do all these things and manipulate testing. So we're a large jurisdiction, but I will say to you, and Commissioner Kirkpatrick can speak to this, but we have regional calls, but we also have our MAC, which is essentially our emergency operations where everything centers out of. And the entire place there is you have about 9 subsets of groups that work on different areas, whether it's housing, whether it's testing. The health district was integral in all these pieces. We still to this day have a call at minimum once a week where we go over positivity rates, we look at resourcing, we're linking up those services. But I use the Cashman ISQ just to give you a sense right out the gate. I think we set up Cashman in about 2 weeks, which from my perspective was pretty phenomenal with full medical staffing. The things I've talked about, I kind of listed here, but I'll touch on some of them that I think that are pretty important. Obviously, that master lease motels and programs. At the writing of this report, we were at about 250. We're approaching now over 600 when you look across all the master leases from both the homelessness side and employee side. Food assistance. So to give examples, we funded Culinary, the largest union of those employees that were laid off as soon as tourism shut down. Mass food assistance going through to them in conjunction with testing assistance. We set up essentially testing sites across the valley that continues to this day for community-wide testing and free testing. But we also, Commissioner Kirkpatrick facilitated this, also wanted to have full assessment of individuals getting tested. What were they out of a job? Did they have reduced income? What did they need in terms of rent? Those types of pieces. Hygiene units, we used our CARES dollars essentially to do master leases on mobile showers to support our homeless population, because we know we can use that short-term and long-term post-COVID. We also, there's a mobile resource COVID outreach RV unit, highway to health model we did pre-COVID. That will be funded, not with CARES dollars, but on the backside, but it's about the practice model changing where we bring services to the clients. Clients just don't come to our building. So we've essentially gone to this virtual system and our outreach system. Crisis stabilization. Just because we're in COVID doesn't mean we don't have people with addiction issues and mental health. So when I talk about those master leases, the programming in those is not a social worker going by once a week. It's on-site 24/7 medical care, behavioral support, and addiction support. We utilized existing providers that we already had to help us build this up and go support the master leases. We essentially, the other piece that I kind of want to talk about is the rental assistance. So this was probably the biggest driver of practice, and I'll talk about what we're doing moving forward. But if you think getting out $88 million in rental assistance is an easy task with your existing staff, you know the answer. It isn't. But what I will say to you is we are doing everything in our power. So we originally started with 14 nonprofits to push out our rental assistance, thinking we would be able to manage the capacity. That stopped relatively quickly in terms of that capacity. We froze it, and then we basically spent our dollars on technology to be more virtual, hired 120 contract staff that do all the contracting and adjudication of those, and we still are struggling with it. We're doing major advertising to support rental assistance right now to get this, and if we have people in our portal queue by December 30th, we can essentially pay their rent post December 30th. But to give you a sense, I think we're encumbered at about $50 million as I sit here today. And in addition to that, we're also working on corporate mediation and also negotiations so we can do mass rental assistance payments to entire apartments as long as they can attest that there's a COVID-related impact in the Treasury guidance. Vendors. So the other issue is with the emergency, we had to crank out, I think I've signed about 32 contracts since COVID started. I don't know if that's good or bad, Commissioner, but to facilitate services and expedite resourcing. In a traditional government world, we're not able to do that. So I think one of the things that I want to make sure I talk about is I talked about the technology and the investment in our technology for the crisis, but that will last us long into the future. And then the other part is purchasing and procurement. There's the procurement process kind of goes to the wayside to some degree when we're expediting these services. So what we're also working on is as we move from COVID CARES dollars into county dollars to continue services, we're going to do some expedited type RFP. They call them kind of like hackathons, which we're designing, which will expedite government release of funds to support qualified programming. And then the targeted outreach, I was on a call earlier with the commissioner and our commissioners on a briefing. This continues to this day. As numbers rise, where do we see the population positivity happening? What jurisdiction is it happening? What diverse population do we need? How do we continue to manage that to support that? And then the other piece I just want to mention was elections, because that was just on everybody's topic. Just managing elections from the perspective of education and COVID impacts was obviously a significant lift. This is the same chart I showed you, but I want to show this because to kind of echo Jeff's point, the crisis creates opportunity. So we've shifted our practice model, but when you see these highlighted red items, these are areas in addition to with the COVID related impacts that will continue and or increase post CARES dollars. So we're utilizing county dollars, which are AB 309 dollars, which was a tax our commissioners passed to support relative areas in the bill. Couple key pieces here: mobile outreach. I talked about the mobile RVs and how we're going to do that. Virtual assistance, client services go to the client. Navigation centers. So we're going to have navigation centers regionally placed throughout the valley that have juvenile justice there, DFS, social service, supported by eligibility and social service care teams so that we can expedite. So I was telling the board yesterday, one of the key issues we had is if I had had this before COVID hit, my rental assistance money would already be out the door. And so the issue is that technology and the move in practice, that opportunity is now here. And we know the mass need we are going to experience over the next 18 months to 2 years based on the economic recovery. If you look at 2009 compared to what we're going through now, it's not comparable. And because of that mass need, we had to change our practice level in terms of going virtual. So these navigation resource centers, as people will be out in these resource centers, they will not be in an office. So we'll be field driven, we'll have RV response, and then everything can be done on a computer with technology. Another example on rental assistance is you go to an apartment complex and some of the people don't have internet access or the ability to get into access the portable rental assistance. So these are all pieces where we're trying to kind of support this new practice model, which we won't go back to. So where we were pre-COVID and where we are now, we will probably be staying somewhere where we are now, or maybe in a hybrid model, but with much more virtual access and mobility. And again, those CARES dollars allowed us to purchase the technology, target, advertise. And I'll be honest with you, as a assistant county manager, but really a social worker, the CARES dollars, and Marilyn can talk about this, but as much as we wanted to like jump out the window because we're in crisis, it was a little bit of Disneyland in terms of designing programs because we could actually get something done in like 2 days, which in government and everybody that is on this call, it's a struggle. When you deal with procurement, you deal with issues. So we were able to be nimble and creative. And that has been a culture shift in our department. They have now become nimble. And I've always been a kind of a preacher of federal funds are great. We want to draw down federal funds. We want to maximize that. And we still do to this day with these programs I'm listing. But we're also using our non-federal funds to augment those and be flexible so that we can actually have better outcomes. Because with those federal dollars, there's rules that get tied to that which handcuff us. So the CARES dollars, the Treasury guidance continues to evolve. They just got a notice 9 days ago on another piece, which is a struggle for counties because we're trying to make up dollars that we may have expended, which is now disallowed. But again, that CARES funding is going to transition. So that rental assistance, all those pieces where we see our biggest crisis. And then there's obviously child protection, DFS, Metro, detention. All the programs I'm talking about here have an impact on reducing that spend as we focus on a recession and a budget shortfall. I put this in just because I wanted everybody to see it. So one of the things that I just talked about how COVID drove practice and what we're doing in master leasing and motels and practice change. But the other part I want to emphasize is we started way back in like April talking about what are we going to do at the end of our CARES funding. We don't want to create programs and then turn it off. So as I said, we're housing upwards of 600 people that we weren't housing in a transitional world pre-March. So we want to continue that program and increase it. That AB 309 funds, the board just approved that for us yesterday on that tax. And what this allows us to do is the top three are things that were funded ongoing as we were in COVID and before. Early childhood, truancy is a key one. We didn't even know we were going to be kind of in a learning from home model. And so the truancy prevention is really a upstream swim to diversion because the eyes and ears for DFS are schools. So if they're home, we have to be able to have access. So when kids aren't logging in, truancy is there. Hospitality workforce training. I just want to highlight that because culinary obviously is a large piece of who's employed across this valley. So there's a huge focus there, and they funded a workforce training program. And then all those areas you see below, homelessness, affordable housing, workforce, and our care teams and personnel, that was all on the stair step that I just presented to you. That plus more will be funded moving forward after yesterday's meeting. So what we're doing is continuing to fund those services and those supports. And logically, obviously, COVID has not ended. So the reality is we had to shift dollars around in that homelessness category to support rental assistance, whereas previously we would not have pre-COVID. So we're basically trying to combine emergent needs and diversion. And I'll use, Marilyn, your example of what you said yesterday in the meeting. One of our issues, like with our marijuana dollars, it's our money, so it doesn't have federal handcuffs to it. So for example, when somebody can't make their last 2 car payments, when somebody can't do something in an emergent situation, The federal rules don't allow you to do that. With our flexible dollars, we're able to divert people, keep people in their homes. If they lose their car, they lose their transportation. They lose their transportation, they can't go to work. Their children get placed if they ultimately can't work and pay for things. So this whole issue of how we divert in the system, if you look at COVID and the crisis, it's created a practice shift, and at the same time, it's augmented where we were and actually add resources. So we've actually increased our capacity in our placements and our services fairly about, I would argue, probably about 15 to 20% of where we were pre-COVID. And that is a significant lift when you look at numbers. But the problem is the numbers are going to get worse, which is why the practice model is so key. And I think the only thing I would close with is to everybody that, I mean, and as a longstanding member of NACO, I think as a regional service provider and as counties, the buck kind of stops with us. You know, when people can't pay their rent, when there's issues that they're facing, I can't tell you how many calls we get. We're like, what are we going to do with this family of 4? And back to kind of supporting our employees, they've been on 24/7. We're responding as quickly as we can. And then I think a challenge for us in the county's world is going to be, we have a legislative session right around the corner, obviously, but the larger discussion is going to be the capacity issues we are going to face from a county perspective, because it's unlike anything we've ever faced before from a perspective of a county-state relationship, because literally the state has no funding, nor do counties. So we have to look at how we approach things and how we can triage. And I don't know, Marilyn, if you want to add anything to that.
Thanks, Kevin. And what I would add is, you know, this is kind of highlighted to our congressional delegation, how we probably have some antiquated federal grants out there because they're not really getting to the surface of the problem. And it goes to, you know, we've asked them to revisit the basic needs. Basic needs is a whole bunch of different things, but if I can only help them pay their rent and their utilities, what about everything else? What about everything in their storage that they've now lost everything? So it ends up reconnecting us. I think we have an opportunity. I think NACO nationally has done a phenomenal job as far as representing us. And we're very fortunate that Nevada is very active with National NACO. And I think that relationship needs to be better enhanced, right? So that they can advocate, because we are unique in Nevada, right? We really represent the entire country, in my opinion, because we have so much rural, we have urban areas, and then everything in between. We have 144 languages in our state, so we have a little bit of everything. And if we're struggling with how to use some of these things, then I can only imagine what other communities are doing. But the great thing about Nevada is we are a close-knit family. We're brothers and sisters. We can agree to disagree, but when it comes to crisis, we're each other's ally and moving forward, and we need to continue that. So there are some folks, at least early on, that I cut out of my circle because they were more headache than they were worth. But I think they've realized that they got to be solution-driven and not part of our problem, because everybody's relying on counties to bring it all home. And that's very hard and a lot of stress on us. So I would just say, I think we have some legislative opportunities. I think that technology does have to be part of this conversation for the long term, but that's no different, right? We've been asking for technology in the legislature since 2005. So we always get empty promises, right? Oh, it's going to happen. It's going to happen. So now we've started it, and now they need to help us finish it, help us long-term get some things out of it. But overall, I think that when this is all said and done, we should write a book or put together a Nevada Bible. So for the next group, at least they have something to start off of, because we've all done this the hard way, but not without everybody's heart in the right place. To, you know, we're resilient in Nevada, but more so than ever, I think that counties do matter, and people realize exactly what we do as counties.
And Marilyn, I just wanted to put out for everybody on, I think one piece I didn't touch on whether you're a rural county or whether you're Clark or Washoe, I think one of the key areas for future human services funding that we're very focused on is going to be insurance and managed care organizations. So clients that are in the hospital and insured cost way more in the hospital than they do if they're in a lower level of care. So that's another piece as we face budget shortfalls across human services where we have to really focus on the public-private partnership side, because any programming you're supporting, rural or suburban, diverts their cost and creates a profit margin. So the issue is we're not asking them not to make money, but they need to invest in our system of care and be a member of our community. So that's the other one that I wanted to highlight that's kind of on the top of our list.
Thank you. And, you know, Kevin, to that point, we at Clark County, we reevaluated our partnerships, right?
Yes. Nonprofits too. You talked about that.
Yep, nonprofits. So we kind of, you know, said either you're with us or you're out, because there's a lot of people that are hungry. So it was yet another opportunity to figure out some long-term goals. So with that, I still encourage everybody to put questions in. We don't have any, so that means we must be getting you a lot of good information. So at this time, I want to turn it over to the Churchill County Commissioner, Pete Olson. So Chairman, let me give you a little bio, because you've done some amazing work and you're a great part of Nevada history, and then we'll let you speak. So Harold Pete, I never knew it was Harold, but Harold Pete Olson has lived in Nevada his entire life, and his family roots in the Silver State go back 4 generations. Pete's time on the family farm evolved in a career where he currently partners with his 2 brothers in the dairy business, milking 2,500 cows in Churchill County. The Olson family has produced milk for Northern Nevada for over 105 years. Pete currently serves on the board of directors for the Dairy Farmers of America. In 2010, Pete was elected to the Churchill County Commission, where he has been serving as the chairman since 2015. Pete began his 3rd and final term in January of 2019. During this time, Pete has been a strong advocate for Churchill County on water issues, guiding results and success of the 2017 flood mitigation, and is proud to have been involved in the construction of a new senior center, a law enforcement facility, and a youth center. Pete looks forward to a bright future for Churchill County in overcoming the challenges brought on by COVID and addressing the county's infrastructure to increase housing availability and to support sustainable growth. So thank you for all the work that you do, Pete, and thank you for being a longtime Nevadan and sticking with us. Appreciate that. Go ahead.
Well, thank you very much, Chairman Kirkpatrick. I'll begin with my program here today as a response that our community and the county in particular saw a need where, after what we'd seen in the springtime, in particular with the schools and keeping kids taught in a better way than what we were able to do with distance learning in the spring, our school district decided that they were going to bring kids back in person, but that also necessitated what's going to happen to the children during the times when instruction wasn't going on, because the school district adopted a system where they were going to take the kids and basically divide them into 2 sets, an AM and a PM, to create that social distancing environment inside the schools. So they basically cut each class in half. Some are to come in the morning, some are to come in the afternoon, and just think of all of the transportation and logistical things that would happen for the parents at that point. And so it was with that in mind that we took a program that we had around for a long time, and that would be the Churchill Aquatic Recreation Education Program, which happened to be CARE, not CARES. We'd had it stood up for about 15 years. It was basically an after-school program and for school breaks in summer in particular. We had some homework assistance, but it was really recreationally based for the kids. The counselors were mainly kids out of high school. I can get flipped to the next slide, please. The care hours ran from the end of the school day, usually about 3 until 6 p.m. And students, as I said, did games, crafts, went swimming 3 days a week. And over the past year, pre-COVID, we added computer coding, 3D printing, and virtual reality lessons through a partnership with the Churchill County Library. Financial assistance was available from Churchill County Social Services and Children's Cabinet, and the standard cost was about $40 a week. Now we move up to the current year operations versus what we'd done in the past. We did in the past about 35 or 40 kids, and honestly, we thought we were going to get a more robust uptake on this. We ended up at about 80 right now. We've been adding about 5 students a week. We really expected 150 to possibly 300, but that just hasn't happened. If we can move on to our partnership page, please. So we changed physical locations. We typically, what we had normally been over at the fairgrounds using facilities that we had over there, they were not going to be able to handle what we thought was going to be the capacity that we were going to need. So we changed physical locations. The school district happened to have a school that was only partially used. And so we took up residence in the Northside Early Learning Center, it also has a cafeteria and playground equipment. The school district provides us with some instructional assistance. These are district employees who are performing tasks normally as playground supervision. That's no longer needed because, like I said, it's broke up into 2 blocks, an AM and a PM, 3 hours of intense instruction, no recreation at all, no recess or anything for the kids. Currently, the school district pays for these employees to work at the care program. In return, care provides significantly reduced rates for the school district employees. The school district and the county work together to deal with issues regarding facilities, maintenance, etc. And additionally, the school district provides free lunches for all the students, including students that were in the charter school that normally wouldn't be part of that program. The care program currently live streams music lessons that's done by the charter school's music teacher. And we also, we hijacked 14 laptops from the Churchill County Library for the students to do homework on. The library also provides weekly crafts, coding activities, and live stream children's book readings. And CARE is also providing tumbling instruction. We go swimming at the Churchill County Aquatic Center 1 day a week at no cost to the students. And we're in the process of preparing lessons in cooperation with the local 4-H. The cost is $50 per week for 5.5 hours or less, $85 for more than 5.5 hours. Churchill employees may use the program at no cost. The city employees, same thing. The county bills the city pays us for their employees. School districts may use the program for $50 a month rather than the $40 a week that was done before. Now, if we move on to the staffing slide, please. We created an instructional assistant position in addition to our camp counselor position. We have hired 3 instructional assistants through Churchill County and 3 others provided by the school district. Our staffing model is 1 instructional assistant and 1 counselor per room, 20 students per room. We typically staff an additional counselor and rec leader during their busiest times to help with program support and pick up and drop off students, special activities. The rec leaders and experienced counselors also in charge of the rec program for all classes. The counselors are in charge of leading any rec activities and monitoring recess outdoor time. Instructional assistants are in charge of assisting with homework, classwork, and providing daily reading and mathematics activities. That was one of our big components. With the limited amount of seat time that they were going to get at the school in particular, we knew there was kids that were going to need help, extra help during the day. And again, our thing was all along to have a model where parents could leave the kids there, instruction would continue, good supervision at a good student to pupil, student to teacher ratio would still be maintained. and all those things could happen so people could stay at work. Transportation, you can imagine the logistics of what the school district did when they decided to do this AM PM model. They still could only afford to bus kids twice a day, not 4 times a day. So parents were expected to pick up the slack. And our CARES program, we did another rummaging around the community to gather up all the transportation assets we could. We ended up buying 1 vehicle, getting another retired vehicle out of our Churchill area regional transportation district, and we hijacked our juvenile probation 14-passenger van and 1 other van, and so that gives us a fleet now of 4 14-passenger vans and a 5-passenger minivan for smaller pickups and drop-offs. Many of our staff act as the drivers for this. They pick up kids at around 11 from 5 different schools, and then during that 11 to 12 o'clock time frame, the schools are disinfecting and getting ready for the next round of kids. And then the kids that we've had at the program, we haul those kids to the school. And then at 3 in the afternoon, the kids that are done with school, we pick them up as well. We are transporting a number of kids within the city limits that aren't necessarily going to our program because the district was not able to do pick up in the city any longer. And some of those kids in our little city would still have to walk a couple of miles to get to school. So we're taking up the slack there. If I could get my last slide there on the COVID policy, please. Students are required to wear masks while inside the building. They can remove the masks outside, inside. For aerobic activities like dodgeball, they let the kids take the masks off. Rooms are set up to allow 3 foot of distance. Rooms are held to 50% of fire code capacity. We do testing out there. It's surveillance testing. We do about 10% of the kids every week. And all students are required to test at least once every 2 months. If they miss a test, we reschedule. If they miss that, they're required to go get a test on their own and stay out of the program until they come back with a negative test. So we are trying to do this. We have picked up a few positives through this surveillance testing. We're trying to stay as safe as we can with the kids in the situation that they're in. We do know that we had some people refuse to be in the program. We encourage parents over testing. We encourage parents to be there during the testing if they wish to be. It happens right on site. And we give the kids an ice cream or a treat after they do it. So it's not really a big deal, but some people made a big deal out of it. Our cleaning sanitation is provided by our counselors and our county janitorial staff. And so far, the program has been a success. The kids that we're helping are able to get more hours of instruction a day and adults there to help them with their classes and their schoolwork. And we're keeping kids from being latchkey kids, or conversely, their parents staying home, or their parents having to leave work to go jostle kids from one place to another. And we're very proud of what we've put together and the partnerships that we've created with the different entities in our community. And with that, I'd open it up for any questions.
Thanks, Commissioner. We appreciate that. At this time, we're going to go and see if we have any questions from anybody, and we're happy to answer any questions. So don't be shy. Go ahead and ask. What I would see is, Nevada really should be proud that we've worked together in many instances, as we have. I think Commissioner Olson, you could probably attest, there's at least 20 Zoom calls or conference calls or something a day. For some of us, we got to do our work at night because we've spent so much time on the phone, but we're super fortunate in Nevada to have those relationships across the state. We have on different scales done portions of the same programming. So it's been helpful. We can communicate and talk a lot as local government. So I'm pretty proud to be in Nevada, and for that reason. because not a lot of my friends across the country can say the same thing. And I've been on some calls that's kind of crazy. So Kevin and Alicia, you want to turn your cameras back on, and that way people feel like we're accessible to talk. So.
Commissioner, this is Dagny. I've got a question. If none have come in through the Q&A yet, I've got one that I might pose to the panel, if that's all right.
Okay, go ahead.
And Commissioner Olson, thank you for all the information on what you guys have done in Churchill County to support the kids in your community that, you know, are home regular learning and maybe have, you know, additional needs that you're helping to meet. And I guess, you know, there's a larger, I think, issue that, you know, we've heard across the state is happening in all the counties with the additional needs with all the kids that are having to do distance learning, and, you know, the need for, you know, sports to come back, you know, and how we do that, and, you know, the mental health impacts to kids. And it sounds like you guys have a good handle on that, and the need to put some programming in place for that. And I don't want to put you on the spot if there's anything else, you know, that you have to add in terms of things that you were seeing in your community and what really was the impetus for you to do that. But I know Lyon County and Clark County also have done additional programming around stuff for kids. And so I don't know if there's anything that Jeff or Marilyn or Kevin have also about what you've done in your counties for the kids with expanding some of the programs to support those kids doing distance learning, or that may have, you know, more needs just because of quarantine and sort of the needs of the increased needs of everyone overall in COVID.
So Jeff, you have any things that you guys have done?
So yeah, in Lyon County in 2008, 2009, we were forced, because the recession was beginning, to eliminate a number of after-school programs. And the Boys and Girls Club of Mason Valley stepped up to plate. And since that time, they now have sites in Dayton, Silver Springs, as well as Yerington, and then the Truckee Meadows Club has a site in Fernley. So they have become partners with us on a variety of youth initiatives. We're able to provide them with funding from CARES dollars, as well as other in-kind services to assist them with getting out of one of the schools in Dayton to have a standalone stand-up facility that would be able to take care of those kids in the Dayton community. We provided them with funding to assist with their Silver Springs and Yerington operation. We've had a great relationship over the years. They do an annual fundraiser called Night in the Country. It's not quite as big as Burning Man or some of the events that happen in Las Vegas, but it brings about 15,000 people to Lyon County every summer.
Never gone.
And they were shut down this year because of COVID. And so the CARES funding and the county and the club working together, we're able to help meet the needs. The club works hand in hand with the school district. And then there are a number of other smaller operations going on in the county that we may not have helped with from a fiscal point of view, but county employees have been heavily involved with ensuring that tutoring, those kinds of things are occurring in some of those smaller venues as well. So it's been phenomenal to watch us get involved with the youth side of things. And then back to relationships. We've always had a good relationship with the school district. Now we have regular conference calls and visits about what's going on and supporting each other. So that's where we are.
So Jeff, you're not making it easy for me, because I don't have those same kind of relationships with my school board trustees, and it's quite the struggle in Clark County, and we have 350,000 kids. I'm trying to stay positive here, because it's not been that easy for us, and that's where I'm excited for rural counties at this point, because you guys are doing it. But what we have done is we've partnered with our own recreation programs, with the city's Boys and Girls Club, the Y, to at least get some of these kids that have IEPs in particular, because worry for the autistic and the special needs kids going backwards. We've made huge strides with them. So we did use our CARES money to keep some of that going as well. Our foster kids all have a safe place to go. So that's kind of where we went. But so Alicia, I bet we have some questions for you to what do you see the future? Because I hear you saying the juvenile justice component. What do we see the future for the kids, and how are you? Is it all going to be Zoom? Is it what do you think comes from that?
Yeah, so thank you for the question. From a court perspective, we split juvenile justice into kind of two different compartments. So we have our juvenile delinquency docket, and that is running right now all via Zoom. Our juvenile services department has done a fantastic job at trying to keep as many of those children out of detention as possible, just recognizing that those institutional settings, they have different concerns when it comes to COVID and disease spread. But all of those dockets have been conducted via Zoom. And then on the juvenile dependency side, so those are our foster care cases. Those were a priority for us getting back up and running, because clearly if social services is out there taking kids into care, we need some place for those cases to be heard. We have statutory guidelines that they have to be heard within 72 hours. Those cases are also right now being heard via Zoom. In both of those arenas where we are still having struggles is how do we safely hold bench trials? How do we get our youth in the dependency system? How do we get some finality to those cases so that if adoptive placements are available, we can move down that path? And then on our delinquency, we've had a couple of youth who have invoked their rights to a speedy trial. Again, how do we hold those bench trials safely while still respecting that there's a right to confrontation? So we do it. There's a whole lot of plexiglass, there are gloves, there are masks, but we do it. On a happy note, because we have so little in the court system that's ever happy, I want to say that adoptions, we have held adoption days fully via Zoom. We didn't know if we were going to be able to do it just because of the processing involved in those cases and the confidentiality. But we had our first Zoom adoption day the Friday before Mother's Day this year. It was a huge success. And I think that on that date, we had 16 kids that went to their forever homes. And that was a huge, huge win for us at that particular time when everybody needed a pick-me-up.
Perfect, and that is appreciative. So because there are no questions, I really just want to say thank you to the panel, because I know we took a lot of time out of your busy day. Most importantly, though, I just want everybody to know that the work that Dagny and her staff do for counties is yeoman's work. She, I'm sure I've called her at 6:30 in the morning, and I'm sure I've called her at 10 o'clock at night, and she's constantly working and offered to sit on every committee that there is where she can make sure that NACO has a voice. So I'd be remiss if I didn't acknowledge Dagny and her staff, because they all do phenomenal work. So with that, I look forward to us, getting through this. We're a resilient state, we're a small state, and we're friends. And hope that you enjoy the rest of the conference. And thank you to our sponsor. I think I might have one more question. Hold on. Nope, they said thank you as well. So with that, we are finished, Dagny. Okay.
Yeah, thank you so much, Marilyn. Thanks, everyone.
All right, thanks. Bye.
Thank you.